So the PHQ-9, very good depression screen. A lot of healthcare settings use it. It's a great depression screen. It has a 9th item that is used as a suicide risk screen. And the question says, how often have you been bothered by the following symptoms during the past 2 weeks? Thoughts that you would be better off dead or of hurting yourself in some way. So there's 3 things wrong with this question, right? First, it says bothered. There are some kids that are unfortunately are not bothered by these thoughts. So 1, you have to be bothered. 2, it has an or in it. If a question has an or in it, you don't know which side of the sentence the patient's responding to, right? So it both over and under detects. For example, that cardiac clinic, if you asked a 60-year-old who's had chronic illness their whole life, if they had thoughts they'd be better off dead, they might say yes. It doesn't mean they're thinking of suicide. It might just mean they think that sometimes, right? And then the kicker is really hurting. It says hurting and not killing. And we know, especially young people, think of hurting and killing as 2 different things. So this is not a sufficient question. And now there's at least 13 research studies showing that the PHQ-9, while being a good depression screen, is not sufficient to identify people at risk for suicide. But we wanted to test this out. So when we were testing the ask on the inpatient medical surgical unit, we had 600 kids, 81 screened positive for suicide risk, 103 screened positive on the PHQ adolescent version, PHQ-A, and 42 endorsed that 9th item. And if you put this together, what you find is had you only given the PHQ, you would have missed 1/3 of the kids at risk for suicide. And had you only done that 9th item, which lots of places do, you would have missed over half the kids at risk for suicide. So these findings really show us that while it is so important to screen for depression, absolutely, it's also important to use a suicide risk specific screening tool to screen for suicide risk.